Hi, it's Jane, and on today's Healthier You, we're actually going to do a little bit of talking about puberty blockers, but also the use of it for transgender and gender diverse youth. That's the term that the Mayo Clinic uses for it. First of all, let's start with the medical disclaimer. Always check with your physician before starting any exercise dietary program. Main thing is the information here is my personal research into different health topics, not to be considered medical advice. Okay, puberty blockers. There are some things that you should know about them. If it seems like kids are growing up quicker today than you were when you were young, it's not your imagination. The average age of puberty has been falling for decades. It's now around 10.5 years old for girls and 11.5 years old for boys, according to the Endocrine Society. The C-19 pandemic sped up the timeline even more. Multiple international studies found a rise in girls seeking care for a precocious puberty during 2020 stay-at-home orders. The condition doesn't have to disrupt your child's life. Providers can treat precocious puberty, which is marked by breast development before age 8 or testes growth before age 9, with hormonal suppressants, also called puberty blockers. With supervision, they are reversible drugs safely and effectively to help delay a child's development until they are physically ready. About 1 in 5,000 to 10,000 children are affected by precocious puberty. Then this comes from the National Organization for Rare Disorders. Maturing too early can jeopardize growth and mental health. And because most girls reach puberty between 8 and 13 years old, and boys between 9 and 14 years old, it can isolate children at an awkward time in their life. So some signs of puberty are it starts with a gland in the brain producing gonadotropin-releasing hormone that sets off hormonal chain reaction in the pituitary gland that spurs reproductive organs to release sex hormones, including estrogen and testosterone. So watch for telltale signs in your child, such as pubic hair, body hair, facial hair, deepening voice, growth spurts, mood swings, especially with girls, and menstruation, and breast development or testicular or penile development, which even at that age, it's hard to do with some kids. Genetics can often predict if a child will be early or late bloomer. Ethnic backgrounds also play a role, with black children developing about a year earlier than their counterparts. Most kids with precocious puberty don't have any underlying health problems. Sometimes a condition can be caused by a hamartoma or other tumor that is formed in the brain glands, in the ovaries, testes, or adrenal glands, according to the National Institutes of Health. Head trauma and radiation infections or malformations in the brain, as well as nervous system problems, could also set off precocious puberty. There was a pandemic inactivity, and that caused a lot of stress in kids. So pediatricians monitor patients' growth along with overall health and well-being. As people stayed home in the beginning of the pandemic, the rate of body mass index increased among young people aged 2 to 19 years old, roughly doubled according to the Centers for Disease Control and Prevention. Body fat generates a puberty-activating hormone called leptin. Higher BMI boosts leptin levels and can kickstart puberty. Stress and anxiety also skyrocketed alongside C19, which may have raised cortisol levels, which is the body's stress hormone, in a way that affected children's endocrine systems. Similarly, kids spend more time on devices for both school and play and less time outdoor. There are a lot of researchers that speculate this lifestyle shift may have released serotonin and dopamine, mood hormones, and lowered the vitamin D, which altered the brain. There are health risks of early puberty, and that's what precocious puberty is, early puberty. Getting a period for the first time, growing breast, or cracking voice can be scary and confusing when a child isn't ready emotionally. Parents may not have even had the chance to discuss body changes yet, and the child could be the first in their class to experience these changes. An early transition, sometimes occurring in kids as young as 6 years old, often hurts self-esteem if left unchecked. Early puberty is tied to depression, sorry about that, nose itches, eating disorders, and substance abuse or use, especially in girls, and also leaves those kids more vulnerable to sexual abuse and harassment. For children who are transgender and gender diverse, it can be worse because their maturing bodies may appear as ages and genders that don't align with how they identify. These psychosocial effects could exaggerate ongoing youth mental health crisis brought on by the C19 trauma. How you can help your child during precocious puberty. Reassure your child they don't need to be embarrassed or afraid. These are normal changes that happen to your body that tell us everything's working okay, just a little bit too early. And like I said, there are some, medications that can be used. And your doctors will run tests, x-rays, ultrasounds, all kinds of things to determine the bone age and any kind of issues that are going on with your child. So expect that to happen. A child might need treatment depending on the cause of early puberty, how young they are, and any resulting mental health symptoms they are experiencing. These could include surgery if there is a tumor to blame. And sometimes these tumors are benign, but they cause problems. Sometimes they can be considered malignant. Endocrinologists mainly treat precocious puberty. These puberty blocking drugs postpone the process by suppressing gonadotropin hormone release. They include Lupron, which is a monthly or once every 3 months intramuscular injection. Pensolvi, a different leuprolide injection administered every 6 months. Triptador, a 6-month intramuscular injection. Supraline, an annual surgical implant. While puberty blockers, I don't want to say blockers, have been scrutinized by some due to their use in caring for transgender children. These drugs have been used since the 1980s and are safe if used appropriately. Side effects such as bone health risks typically only occur with prolonged use past the age of puberty. So your physicians can help your child if they do have precocious puberty. Now, puberty blockers for transgender and gender diverse youth. They can be used to delay the changes of puberty in transgender and gender diverse youth who have started puberty. The medicines most often used for these purposes are the same ones that we already talked about, plus a few more. When taken regularly, they can stop the body from making sex hormones. That includes testosterone, and estrogen. Sex hormones affect primary sex characteristics. These are the sexual organs present at birth. They include the penis, scrotum, testicles, the uterus, ovaries, vagina. Secondary sex characteristics. These are the physical changes in the body that appear during puberty. Examples include breast development and growth of facial hair. In people assigned male at birth, the GnRH, which is the what they call analogs, the gonadotropin-releasing hormone analogs. These slow the growth of facial and body hair, prevent voice deepening, and limit the growth of the penis, scrotum, and testicles. In people assigned female at birth, this treatment limits or stops breast development and stops menstruation. What are the possible benefits of puberty blockers? Gender identity is the internal sense of being male, female, neither, or some combination of both. Gender dysphoria is a feeling of distress that can happen when gender identity differs from a person's assigned sex at birth or from sex-related physical characteristics. Some transgender and gender diverse people experience gender dysphoria. Others do not. For transgender and gender diverse youth who have gender dysphoria, delaying puberty might improve mental health well-being, ease depression and anxiety, improve social interaction with others, lower the need for future surgeries, ease thoughts of actions of self-harm. Taking puberty blockers alone, however, without other medical or behavioral treatment, might not be enough to ease gender dysphoria. So what are the criteria for the use of puberty blockers? In most cases, to begin using puberty blockers, an individual needs to show a lasting pattern of gender nonconformity or gender dysphoria, have gender dysphoria that began or worsened at the start of puberty, address any psychological, medical, or social problems that could interfere with the treatment, be able to understand the treatment and agree to have it. This is called informed consent. Puberty blockers are not recommended for children who have not started puberty. In most cases, youth aren't old enough to get medical treatment without a parent, guardian, or other caregiver's permission. This is called medical consent. For those who haven't reached the age of medical consent, a parent, guardian, or caregiver often needs to agree to the use of puberty blockers. Parent and family support for the patient are encouraged also, which have been shown to be an important part of boosting mental health and well-being throughout this treatment. Are the changes permanent? These analogs do not cause permanent physical changes. Instead, they pause puberty. This offers the chance to explore gender identity. It also gives youth and their families time to plan for the psychological, medical, developmental, social, and legal issues that may lie ahead. When a person stops taking the analogs, puberty starts again. When does treatment usually start and end? In general, puberty starts around age 10 or 11, though it may start earlier or later. The effect of puberty blockers depends on when a person begins to take the medicine. These analog treatments can begin at the start of puberty to delay the development of secondary sex characteristics. In slightly later stages of puberty, the treatment could be used to stop menstruation or erections. It also may prevent further development of secondary sex characteristics. While many people take the medicine for a few years, everyone is different. After delaying puberty for several years, some teens might decide to stop taking the medicine, or they may start taking hormones that match their gender identity. This is called gender affirming hormone therapy. How is the medication given? It is prescribed, given, and monitored by a healthcare professional who has expertise in this group of medicine. The medicine typically is given as a shot, either monthly, every 3 months, or every 6 months. Or it may be given as an implant placed under the skin of the upper arm. The implant usually needs to be replaced every 12 months. While taking puberty blockers, regular blood tests are needed to check the medicine's effectiveness. Regular appointments with the healthcare team to check for side effects are also important. So what are some of the possible side effects and complications? Possible side effects include swelling at the site of the shot, weight gain, hot flashes, headaches, mood changes. Some of the long-term effects may also be growth spurts, bone growth, bone density, fertility, depending on when the medicine is started. If individuals assigned male at birth begin using the analogs early in puberty, they might not develop enough skin on the penis and scrotum to be able to have some types of gender-affirming surgeries later in life, but other surgery approaches are usually available. Those who take the analogs typically have their height checked every few months. Yearly bone density and bone age tests may be advised. To support bone health, youth taking puberty blockers may need to take calcium and vitamin D supplements. It's important to stay on schedule with all the medical appointments. What other treatments are needed? Assessment and counseling by a behavioral health care professional can help youth and their families as they move through the decision-making process about puberty blockers. Behavioral health care also is an important source of support while taking puberty blockers. Talking about an individual's gender identity with teachers, school staff, and staff in other organizations in which the youth is involved also may help ease social adjustment during this time. After a time of adjusting to the puberty blockers and confirming gender identity, gender-affirming hormone therapy might be an option. This can develop masculine or feminine secondary sex characteristics to help better align the body with an individual's gender identity. Some of the changes triggered by gender-affirming hormone therapy cannot be reversed. Others may require surgery to reverse. There are some other medicines that can be used, but those haven't been discussed in this. And I would think the main thing is you need to have family members involved in this, but also you need to have a family member, if the child isn't old enough, mature enough to understand the decision, the choice that they are making, the parent has to be able to give medical consent. And that is some of the things we have been seeing over the past few years that many organizations are trying to do away with. The family being involved, look at that hair sticking up. The family being involved, for all of the health team to come together, is including mental health and behavioral health. That is a must for some of these kids and some of these even young adults as what they're going through. And I'll be honest, I don't think that anyone under the age of 18 should have any gender-affirming surgeries. I think that they are way too immature. If you've ever dealt with even an 18-year-old, sometimes even 19-year-olds, they're not mature enough to make mature decisions, especially some lifelong decisions. If your child is mature enough, that's a decision that you and the family make. But I just got a problem with young people taking such a drastic step when they are not mature enough, and they many times overlook the informed consent and just don't really pay attention to some of the things that could happen later on. So, and that was just, these puberty blockers, like I said, they can be used for many good things. And sometimes they're warranted. I understand that a lot of folks that don't identify as being the gender that they were born with, but I think they first need to have some mental health, behavioral health, to help determine if that is something that is deeply rooted or if that is society and peer pressure from those around them. I think that's probably one of the first steps that needs to be done. And that's my opinion on that. All right, guys, this is it for this video. I hope you learned a little bit more about puberty blockers. They have been in the news for quite a few years, and a lot of people talking about them. Like I said, there are some good uses for them, but I do think that they, just like many other drugs, are being overprescribed. All right, see you guys soon. Bye.